I'm Dr. Joshua Yamamoto, and welcome to Real Doctors, Real Medicine. This is a show about just that, real medicine. What type of advice do we get from real doctors in practice to try to help us understand what we should do for our own health? We're brought to you by the Foxhall Foundation, which is a nonprofit organization dedicated to helping everyone age well. So the first question is, with so much medical information out there, why on earth would we want to watch another podcast? And the answer is really because there is so much information out there. How are we supposed to digest all that? How are we supposed to interpret all of that? Who do we trust? And I have to tell you, I would rather you not trust anyone blindly, me in particular, but what I'd like to do is present information in a way to help you learn how to ask questions. How does this information, how does this new piece of data affect me, affect my life, my needs, my priorities? What do I do with this? How do I understand this? Because we're all different. And the information out there is maybe applicable to the whole population, but maybe not to me. So, real doctors practicing real medicine. Just a bit on who I am. I am a cardiologist. I am an invasive preventive cardiologist. What does that mean? Prevention isn't just about eating right and exercising. Of course, that's a role, but it may be a lot less of a role than you might think. It's not just about your diet or what roots and berries, and I promise I will never ask anyone to buy any particular supplement. We are a nonprofit after all. But what do we prevent? We prevent premature death. We prevent premature suffering. A cardiologist will prevent heart damage, heart failure, brain damage, dementia. Dementia relates a lot to good circulation to the head. And you know what? Prevention isn't just about avoiding things. You often have to actively do things. I'm fond of saying prevent is an active verb. So what do you do? This is why I'm also an invasive cardiologist. I do things, or I arrange for things to be done when that's what's necessary to prevent unnecessary early death, damage, or unnecessary suffering. Kind of like to say in medicine, everything is about living longer and living better. Better as in reducing suffering. How do you feel? Is this to make you live longer with more suffering or suffer less? What are we doing? So always try to ask those questions. I grew up in the Washington, D.C. area. I didn't start thinking I was going to be a doctor. I actually studied physics. I have a degree from Princeton. I went to medical school finally, and the point of mentioning a physics degree is that physicists love to answer the question, why? We talk a lot about causality, meaning cause and effect. Things happen for a reason. So the better we understand the reason of how something happens, the better we are to manage whatever that process is. It isn't just about labeling something and going down a pick list. I train medical students. I often ask them, explain to me the difference between a digital and an analog watch. I have an analog watch. I know time as a quarter till or half past. I see things in terms of where we've been and where are we going, not just the moment of where we are. And that's the way we all live life, and that's the way medicine and health works. When I went to med school, one of the deans pointed me out and said, "Oh, you were a physics major. That means you didn't learn anything." And he meant it as a compliment and as an inspiration or warning to my classmates. We didn't just learn lists and names. We learned how to solve problems. I went to Dartmouth Medical School, then came down to Johns Hopkins where I trained in medicine, and then they kindly reminded me of something I signed, and I spent 8 years on active duty in the Navy where I finished training in cardiology. And after a stint in the Iraq and Kuwaiti desert, my wife told me it was time to be in private practice. So since that time, for the last 20 years, I have been in my own private practice. I see patients every day. I have a foundation in academic medicine, so it's important to understand what we commonly call the scientific basis of medicine. I trained at Johns Hopkins, where we take science and the scientific process very seriously. But I also understand that never before in human history have we had millions and millions of people over 60, 70, 80, 90. And so we are kind of off the map, so to speak. And the practice of medicine involves taking care of people that we have no historical knowledge of what to expect. So we're charting our own course. I mentioned that I'm part of the Foxhall Foundation. The Foxhall Foundation was started over a decade ago by Dr. Kristen Thomas, who will be our occasional co-host. She's brilliant and essentially knows everything. In the Washington area, the Johns Hopkins Health System bought the local hospitals, which was wonderful. And we were familiar with a lot of the scientific programs that were available at Hopkins. And we thought, gee, why can't we bring those into the community? So that was really one of the original purposes of the foundation, to try to bridge gaps between scientific research and actual practice, what real doctors were doing with real patients on a day-to-day basis, because there's tons of information out there. We like to think of ourselves as filling gaps between academic research and clinical practice, between doctors and their patients, and between what's available on the internet and the media and everybody else. One of the things I love to point out is the Foxhall Foundation is entirely funded by individual donations, not by any corporate sponsorship. We don't sell things. So I'm never going to pick up a bottle of something and say, this is the magic elixir that you need to drink. I'm just here to try to help us all think our way through the practice of medicine and how to maintain our own health. So at the foundation, we have a few perspectives, ways of looking at things. One of the chief ones is to say healthcare, medicine is really about the relationship between a doctor and a patient. That's where we practice medicine. That's where it starts. Obviously, there are many, many things that go on outside of the doctor-patient relationship, but that's the special part of medicine where you as a patient are an individual and I as your doctor am personally responsible for your outcome and your well-being. And I need to understand everything I can about you. So we will emphasize a lot about how important it is to have a relationship with the doctor. And yes, I've done interviews before and people often say, but I can't get a doctor. Well, we can always get a doctor, and maybe we'll do an entire show on how the system works and how to navigate the system so you can maintain a relationship with your doctor. I often tell folks, if you don't know your doctor's name, how do you expect them to know yours? So it's important. Also, we really like to point out that life is not just a collection of diseases. We have a system now that requires everything to be labeled as a disease or there's no reimbursement. People wonder why there's an increase in chronic illnesses, because if you want to see your doctor has to code for a chronic illness or they don't get paid. So we are creating this notion that everything is a disease. You know what? Life isn't all just a bag of diseases. There are a series of processes. Things happen as we age naturally. And just because something naturally happens, that doesn't make it a disease, nor does that mean we have to accept it. There are a lot of things that we can manage as we go through time. When I talk about cardiovascular issues, I often make the point that there is almost no such thing as heart disease. It's just a matter of natural aging and how we manage that. And so that gives us a different perspective, and it gives us a great opportunity to manage life as we age. We also understand that everyone is unique. We do great medical trials and research studies, double-blind, placebo-controlled trials, but that doesn't mean everyone is just like the people enrolled in that trial. So science is the beginning of wisdom, but it's not the whole story. Science is what often gives us guidelines, but it's also important to know that guidelines were neither meant to be proscriptive, meaning they tell you what you must do, nor are guidelines meant to be restrictive, telling you what you can't do. It's just the beginning of how we help people. And clearly, we know that different people want different things out of life. We all have different experiences, and we have different genetics. We are not all the same. And again, this is the importance of navigating your life and health with your doctor. And you know what? We all have different definitions of health. I meet a lot of people who say, I'm healthy, I don't take any pills. Really? Sometimes pills actually help us maintain our health. I would define health as not dying earlier than I want and not suffering more than I need. And sometimes with life, there's a certain amount of wear and tear, and there are things we can do to prevent that from causing heart damage, brain damage, organ damage. So not doing something doesn't necessarily mean you're healthy. So we all have to respect that we have a different point of view of what health is. And again, I like to think of medicine as what do we do to help people live longer and feel better. So we want to put together a series of shows, podcasts, and broadcasts. We have a series of talks on understanding the process of health and aging. We want to start off with a whole series of talks that we give on how to prevent vascular dementia. That covers a lot of ground. Senile means age related. And as we grow old, things change. And certainly our brain can change. But you know what? A lot of that is a very well known process or a series of processes. So there will be quite a few talks on how to manage aging to protect our brain to prevent dementia. There are whole hosts of processes that are part of natural aging that we'd like to explore. We also, from time to time, will try to do timely topics. Things come up in the news all the time, and we're always asked every day in our practice, what does this mean? What vaccine should I be getting? Tell me about hormone replacement. I just heard on the radio that melatonin that I use for sleep can cause heart failure. These are a few examples of things worthy of discussion because the answers are rarely as simple as, oh, yes, I need this pill, or I should never take this pill, or I should do whatever. I will tell you that exercise is always good. I'm not sure there's ever been a study to show that exercise hurts anything, but everything else really deserves a little bit of thought and discussion. So we'll try to do some timely topics. Also, in our shows, we will like to address some common misperceptions, and there are a lot of them. Help people to really understand how to apply medical knowledge for their personal health. And finally, we are fond of saying that, the internet didn't go to medical school, but your doctor did. We certainly did. We will do our best to try to help you understand what are your issues when you get information, how to ask the questions, how does this affect me? What can I do with that? What questions can I bring to my doctor? And where else is a better place to get a lot of that information than from a real doctor's practicing real medicine? So I hope you tune into our podcasts and broadcasts, and I look forward to answering questions. Thank you for your time.